Okay, I see that.
What the most important thing that it causes is dysrhythmias, and like the main dysrhythmias it causes is VFib and VTAC.
Yeah.
They're the most dangerous. Okay, that's probably very important. Let's see. Okay, you gotta look at some other drugs.
We can do. Let me see if I can find it. What about the human B type? Whatever that M word is.
Oh, the Maceritide.
Yeah.
Okay. Let's see. Some important things, of course, is the mechanism of action. So it suppresses rise. It suppresses the sympathetic outflow from the central nervous system and has direct dilation of arterioles and veins. So that's something that we need to remember.
Well, then I wrote down right here, it says shouldn't be used long term and
Right.
more than 24 hours.
Okay.
Okay, so I'm just gonna write some stuff on the board.
Alright.
It's just like
Okay, so are these just some of the drugs that
yeah,
going to be on the exam?
Yeah, I remember her saying most of these drugs right here, and then I just wrote out the diagram.
Right.
Just to give us
So
a
how
visual
rise
for us.
works.
Go. Wow, this form is really stressing me out right now. It's very overwhelming. I can't take it. It's just a lot going on right now.
Are you okay?
No,
I think you're having a panic attack.
no, I think I'm having an asthma attack right now.
Are you on any type of medication?
No, I'm not on any meds right now.
Okay, I think we need to go to the doctor.
Okay.
Take a deep breath. That's good. Are you okay?
Leah, are you ready?
Yes, I'm ready.
All right. Come on in. Have a seat. Okay. Hello, Leah. My name is Dr. White.
Nice to meet you.
I'm going to be taking care of you today. So to start off, I just have a few questions. So what seems to be bringing you in today?
Well, I was sitting with my friend, and all of a sudden I just started having an asthma attack. My chest was starting to hurt real bad.
Okay. All right. Well, we can see what we can do about that today, okay? Do you usually get episodes like this?
No.
Okay. So this would be like the first one.
Yes.
All right. And did your chest hurt?
Yes.
Okay. On a scale of 1 to 10, how badly?
I'll say 6.
Okay. All right. Did you feel like you couldn't breathe at all?
No.
Okay. Alrighty. Well, let's see. Okay, Leah, so I'm going to take a quick listen to your lungs while you're breathing, okay? Just continue to breathe how you are. Okay, can you... Okay, so it sounds like you might have some asthma. I'm gonna go ahead and prescribe you an adrenergic bronchodilator called albuterol. It's just a little puff and release nebulizer, but you can also take it in several other forms if you want. There's an oral syrup, there's a dry powder nebulizer, there's an aerosol nebulizer, there is pills that you can take of it, but I just think that the nebulizer itself would be the easiest form for you to take it in. I'm going to go ahead and prescribe you 90 micrograms every 20 minutes during your first hour of like exacerbation and not being able to breathe. But then after that, you can take it as needed, okay? So every time that this flares up and you get out of breath, just do a little puff, okay?
Okay.
We never heard of this medication before. Can you tell us a little bit about how it works?
So yes, I can. Albuterol binds to the beta-3 adrenergic receptors in your lungs, and they dilate your bronchial smooth muscles. They also make your mast cells less hypersensitive, so it will be able to open up your lungs a little bit better, so that you can breathe and it functions properly. That way you're not taking sharp little breaths and you feel like you can get a full lung full of air. It will also help the oxygen move into your blood so that you feel more oxygenated. But this does start working in about 5 minutes. So you will have a little bit of time before it starts completely working. But after 5 minutes, if it's not working, you can take another puff of your inhaler. And usually once it starts working, it'll work for about 3 to 6 hours. And you won't have to take it again. But if it does if you do need to take it again, that's totally fine. It's a take as needed type of drug.
It's really hot in here. Let's take some of my coat right quick.
Okay, before you do that, let me just let you know that while you're on albuterol, there's a greater risk of your glucose in your blood increasing. This could cause you to be hyperglycemic. So while you're on albuterol, you want to decrease the sugar intake, especially right around the time that you take the albuterol puffs, okay?
Okay.
It also can increase your risk of having decreased potassium in your blood, which can cause you to be hypokalemic. So you're going to want to also increase your potassium levels, especially if you're on any other drugs like digoxin or anything like that that are influenced by the potassium levels. Okay?
Yeah. Okay.
Okay. How old are you?
21.
Okay, good. Because if you were on the geriatric side, I would have to monitor your renal functions and do some lab work on that. And I would also need to monitor your heart rhythm and rate, because there are some effects of this drug causing you to have a prolonged QT interval. And then, are you pregnant or breastfeeding right now?
No, but why are you asking?
Oh, because I just needed to know, but there are no considerations that we have for breastfeeding and pregnancy, because this drug doesn't interact with those.
Okay.
Can you tell me exactly what this drug is used for?
Yes, I can. So this drug is specifically used to prevent and treat any difficulty breathing, wheezing, shortness of breath, coughing, chest pain, and tightness that could be caused by asthma, COPD, smoking, any of that kind of stuff.
Okay.
Can you tell us some side effects of this medication?
Well, the common side effects are
Oh my god, my heart is beating up my chest right now. Okay, deep breath, deep breaths.
Oh my God, cramps!
Oh, I feel so jittery right now.
Okay, so there are a few things I want to talk about before I let you go today, okay? So we're going to do some patient teaching points. First thing is I want you to take your albuterol inhaler at the same time every day for your first dose, okay? On top of that, I'm going to teach you how to actually use the inhaler.
Okay.
So what you're going to do is you're going to hold the inhaler with the solid part, like the cylinder part up and the mouthpiece at your mouth. You're going to place your lips around the mouthpiece, and you're going to form a tight seal so that none of the medication gets out of the seal, okay, and it all goes into your body. You're going to slowly breathe through your mouth and press down on the inhaler so that the medication is released and you're slowly breathing it in. And you're going to keep breathing it in slowly, as deeply as you can into your lungs, and you're going to hold it for 10 seconds, okay?
Okay.
And then if you have to take a second puff, you're going to wait at least 2 to 3 minutes.
Okay.
All right?
Yeah.
Okay, can you show me how to do it? Okay, good. So another thing that you want to know is that if you have high blood pressure, you don't want to take albuterol, okay? Because it'll increase your blood pressure. I don't think that you have a history of high blood pressure, but in the future, if you do have high blood pressure, just be aware of that, okay?
Okay.
Also, you need to be aware of the triggers for your asthma, okay? So that includes like pollen, freshly cut grass, any person around you that's smoking, respiratory infections, physical activity. So start trying to pay attention of when your asthma attacks happen so that you know what your triggers are and you can avoid those later on.
Okay.
Also know that there are some irritants that will cause a flare-up for pretty much anybody, such as tobacco smoke, chemicals, strong perfumes, strong other chemical fumes. So just try to stay away from that kind of stuff. Anything that's like strong smelling that could go into your lungs and irritate it, all right?
Okay.
Okay.
Is there anything that she shouldn't be taking or eating while on this drug?
Yes, I'm glad you asked. There are a few things that you want to avoid while you're taking this medication. It's not a really serious thing, it just is for your comfort and your safety. So firstly, you're gonna wanna avoid caffeine. It can make your heart rate increase, and that can cause you to feel like your heart is beating out of your chest with the two combined.
Okay.
You're also gonna wanna avoid hydrochlorothiazide because it also will do the exact same thing and make your heart beat out of your chest. But you can, if you're taking that drug and you're taking albuterol together, you can add in cardioselective beta blocker such as metoprolol because it will slow down your heart rate.
Okay.
You also will want to avoid taking anything that has more epinephrine effects. That's because it also will increase your heart rate and it will make you very uncomfortable. And lastly, you want to avoid acetaminophen because it will also increase the inotropic effects of your heart, okay?
Okay.
Okay, Leah. Do you have any last questions for me?
No, I don't think so.
Okay, well thank you so much for coming in today, and I really hope that this albuterol will help you out, okay?
Okay.
And if it doesn't, just come back to see me in a couple weeks.
Okay.
All right,
Thank you so much.
have a great day.
You too.
Are you having another asthma attack?
I think so, but no worries. I got my albuterol.